Good morning to you all. I'm Renee Francaire with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and Dr. Catherine Elliott, the Acting Chief Medical Officer of Health. Closed captioning is provided by National Closed Captioning. Thank you to Mary Teason for providing our ASL interpretation today. A friendly reminder, we will have no French translation available today. Following the remarks from our speakers, we will go to the media present in the room and then on the phone lines for a round of questions. I will call you by name, and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I will now hand it over to Premier Sandy Silver.
Thanks, Renee. And good morning, everyone, and thank you for joining us today on the traditional territory of the Kwanlin First Nation and the Ta'an Quechin Council. Today is an exciting day. For some, perhaps it's a long-awaited one as well. It's also an anxious day for very many folks, and our government recognizes that as well. That is why we're here to talk about it. I'm pleased to be joined by the Acting Chief Medical Officer of Health, Dr. Catherine Elliott, for this COVID-19 update. On August 25th, which is the day that the state of emergency ends under the Civil Emergency Measure Act, or as we call it, CEMA. Just a bit of an update as well. We have 2 new cases to report as of yesterday. The number of active cases is currently at 36, though that number may change as new recoveries or cases get confirmed today. We also have 1 new exposure notice issued yesterday afternoon for the 10:05 a.m. Air North flight from Edmonton to Whitehorse on Saturday, August the 21st. This is a low-risk public notification. Last week, you will recall that we reported our first 2 cases of the Delta variant. Delta and variant, these are frightening words, and it's something that we take very seriously. But it was also an expected reality that we knew we would be eventually facing as we all continue to live with COVID-19. Now, both people who contracted the Delta variant contracted it from outside the territory, so there was no exposure events within the Yukon associated with these cases. As of today, the Delta variant cases remain contained, and there are no other people in the territory with this variant. However, we know we must, of course, remain vigilant as we see surges of Delta around the world. It is still so very important to continue to wear our masks when in crowded places, and to physically distance as well. You'll find me still wearing my mask when I'm in large meetings or when I'm shopping in stores. It's also very important to continue to practice good hygiene and proper hand washing, to stay at home when you're not feeling good, to go get tested if you have symptoms, and most importantly, get vaccinated. As I say every moment that I get the chance to say, immunization, vaccines, remain the most powerful tool to allow us to treat COVID-19 as a largely preventable disease. We have enough vaccines for everyone who wants one, so please, if you have not received your shot yet, protect your loved ones and your community and book an appointment right now at yukon.ca/thisisourshot. More than 80% of the eligible Yukon population over the age of 12 are now fully vaccinated. That's incredible. We continue to lead the country in vaccine rates. This is such positive news, and I'm so very proud of everyone who helped us get there. It is due to your extraordinary efforts and the continued advice of the Chief Medical Officer of Health that we can now mark a fundamental shift away from response mode towards living with COVID-19. We can forge ahead in the transition from pandemic to endemic. This means a state of emergency under CEMA is no longer required to manage the impacts of the COVID-19 pandemic. The risks have changed, and a more targeted approach is now called for. Now, on Friday, we released Forging Ahead, the Yukon's continuing response to COVID-19. This document, guided by the advice from the Chief Medical Office of Health, maps out our path forward and is centered on 6 pillars. You can find them and read them all at yukon.ca. Forging Ahead, document here, is the next step for how we will respond and manage as the civil state of emergency comes to an end. It's all about enhancing the health and well-being of all people in the Yukon while also preventing severe illness and death from COVID-19, especially amongst our most vulnerable populations. We are in a very different situation than we were when the state of emergency was first declared back in March 27 of 2020. We have learned so much about how to manage COVID since then. We have seen the effectiveness of masking up, of physically distancing, and also of getting vaccinated. It's time to minimize the impacts of broad, restrictive public health controls as we mitigate the risk of infection. We know that we need strong physical and mental health. We need strong social connections, economic vitality, as we move on with our recovery. We are following the science, and I'm very confident the flexible measures that are in Forging Ahead will help move us forward in a very safe way that benefits all of us. Now, the civil state of emergency will expire tonight at 11:59 p.m. The most noticeable changes will be the end of enforcement measures under the Civil Emergency Measure Act. There will also no longer be any legal limits on gathering sizes in the Yukon. It is important for Yukoners to remember that while there is no longer a requirement to self-isolate after travel, the Chief Medical Officer of Health can order individuals who have tested positive for COVID-19 to self-isolate under the Public Health and Safety Act. The Office of the CMOH can also order contacts of positive cases to self-isolate. And they have the authority as well to charge individuals who do not comply with a self-isolation order. Now, Dr. Elliott will be able to speak more about this in a bit. We use many tools during the civil state of emergency to support Yukoners over the past 17 months as our world flipped upside down. This included things like extending leases, permits, and other approvals, enabling our pharmacists to extend prescriptions, just to name a few different examples. Now, while some of these ministerial orders will end immediately when the state of emergency is over, others have a transition period of up to about 90 days, up to 90 days. Now, for a full list of orders that have a transition period, visit yukon.ca. They're all listed there. Now, as we move on from the state of emergency, the civil state of emergency, we will continue to follow the recommendations of the Office of the Chief Medical Officer of Health, as we have throughout the pandemic. That will not change. As you can see in the contents of Forging Ahead, ending the state of emergency does not leave us without tools to manage COVID in the Yukon. We are actively monitoring the situation here and in other jurisdictions and continue to engage with our partners across the territory and across the country. The availability of vaccines has completely changed the landscape when it comes to COVID-19 and significantly changed the risks that we are facing. That being said, Yukoners should know that if the risk changes, we will adopt as necessary. Nothing can be set in stone in this dynamic, always changing health situation that we're all faced with. I do want to thank all of the Civil Emergency Measures Act enforcement officers for your dedication and your long hours. I know it wasn't easy, and I'm truly grateful for all of the work that you've done to keep our territory safe. Thank you very much. I also want to thank all of the public servants that have helped us manage the pandemic over the past year and a half, including those who've worked so hard getting the new document here, forging ahead, update it and ready, and also some of the previous documentation as well. Truly, thank you, everyone. The vaccine clinic teams, the healthcare workers, the essential service providers, business owners, teachers, parents, first responders, volunteers. The list goes on and on and on. Professionals in their fields, all coming together as a community and playing critical roles in managing COVID-19. We couldn't have done it without you. Thank you from the bottom of my heart. I want to let Yukoners know that, like many other jurisdictions in Canada, we are currently developing an easy and secure way for Yukoners to get official proof of their COVID-19 vaccination online. This will have features built in to prevent forgery and will also allow it to be verified. There will be more to come on that very soon. As a reminder, currently Yukoners receive a card upon vaccination, and you can also submit a request for their paper vaccination records through your local health center. I mentioned last week that we need regular weekly updates, that as the need for the regular updates tapers off, as our vaccine uptake continues to rise and our current cases continue to stabilize. As such, our next COVID-19 live update will be in 2 weeks from now instead of in 1 week. We will see you back here early in September. So we will continue to monitor daily activities to keep Yukoners informed, and our information bulletins that are issued on Mondays and Wednesdays and Fridays will continue. We'll also continue to report our numbers on yukon.ca. You can always check there for the most up-to-date information. And as always, if the situation changes, we will be here to let you know the details. So onward we go. Thank you very much for listening over the past year and a half to our weekly updates. And I'll pass things off now to Dr. Elliott. Thank you very much.
Thank you, Premier Silver. Good morning, bonjour. I would like to first acknowledge and my gratefulness for speaking today. Let me start again. I would like to first acknowledge how grateful I am to speak to you today from the traditional territory of the Kwanlin Dun First Nation and the Ta'an Gwich'in Council. Today, together, we take an important turn along our path. I am pleased that the state of emergency will be lifted as of midnight tonight. This is a good day and one we have long been waiting for. During this encouraging time, we will be able to enjoy many of the activities that we left behind in March 2020. All the while, will we each individually and together find our new ways of navigating life with COVID-19. Last week, we talked about the important actions that have been underway to end the state of emergency and prepare us for this moment. The key tools during this transitional stage are outlined in Forging Ahead, as Premier Silver alluded to, and these include vaccinations, testing and surveillance to ensure that we're following our situation closely and continually assessing risk. They include the capacity to surge when necessary in order to respond. It includes supporting those who are vulnerable and building upon our key partnerships with communities and First Nations. These are the tools that we need to move forward and be as healthy as possible during this pandemic, as well as to protect those who are most vulnerable. As the Premier stated just now, as we lift the state of emergency, we will move from regulations and enforcement to recommendations for many measures. Excuse me. At the same time, the public health emergency remains, and we will continue to use the powers under the Public Health and Safety Act, when they are important to control the spread of COVID-19. Not the least of these are the instructions to self-isolate for those who are infected and those who could spread COVID-19. Self-isolation is enforceable under the Public Health and Safety Act, and while we would prefer to help people to understand the importance of self-isolation and to give them and offer them the supports that are necessary, we will use enforcement when needed. The main shift that we will see as CIMA ends is that people will now be able to make their own decisions about public health measures. This is not a license to abandon all measures, but rather a call for each of us to act responsibly. This means that we can each assess our own personal risk and take precautions accordingly. It might include, for example, wearing a mask when we are around those people who are most vulnerable, when we are ourselves not feeling completely on our game, or simply out of respect. It means following the guidance of businesses because they too will have my recommendations to take certain precautions and reduce possible transmission of COVID-19. These things to prevent transmission and protect those who are vulnerable are the ways that we will move forward. Tomorrow morning on yukon.ca, you will be able to find some new guidance and some updates to older guidance. I hope this guidance provides the clarity that you need to navigate this transition with confidence as we become more accustomed to living with COVID-19. Now for the update on COVID activity in Yukon. Overall, COVID-19 activity is continuing to stabilize with consistent numbers of new and active cases and declining numbers of hospitalizations from over a month ago. This is a promising sign and demonstrates that despite a surge of cases across Canada from a challenging variant, and despite having experienced our own challenging variant surge here in Yukon with the Gamma variant, we have effectively controlled COVID-19 in many situations in Yukon through testing, isolation, and our partnerships. Thank you to all Yukoners who have done their part to follow our recommendations. Today, I want to offer a special thank you to those who got tested and awaited their results, to those who have followed directions to isolate and thereby prevented further transmission. These are the types of actions it takes to fight this pandemic. As of yesterday, there were 36 active cases of COVID-19 in the territory, and 641 people have recovered since this wave began. We have lost 6 Yukoners to COVID since June, and 8 since the onset of this pandemic. We have not seen a death since August 2nd. The situation in Ross River is stable, and we are continuing to respond. The partnership and collaboration between the government, including community nursing, YCDC, and many others in government, as well as our community and First Nations partners, has been critical to this response. Overall in Yukon, we continue to see some transmission within local clusters and in household chains of transmission. The main driver of new cases is transmission within Yukon between people who are not yet vaccinated. We have seen the Delta variant introduced into our territory, and I would not be surprised to see more cases of Delta variant. Whether it spreads will depend on all of our actions. COVID-19 situation in Yukon is stable, and we're learning to live with COVID. I want to provide a sense of the role of vaccination in protecting us from the worst outcomes, and to emphasize that the brunt of this wave has been suffered by those people who were not yet vaccinated. All of the people who have died in Yukon in this entire pandemic were not vaccinated. The overwhelming majority of those who have been hospitalized were not vaccinated. We have now seen in Yukon what we have learned from the evidence elsewhere. Vaccination protects from infection, severe disease, and death. I am also pleased that over 80% of eligible Yukoners are now vaccinated. While we're leading the country and the world in vaccination rates, it is not enough. Yukoners who are not vaccinated remain at risk. When more Yukoners are vaccinated, more of us will be safer and protected from COVID-19. This is our best shot. Please do the right thing, Yukoners. Go to yukon.ca, this is your shot. Book your appointment or drop in. Please get vaccinated. If you have already been vaccinated, congratulations for taking this step to help all of us get to where we are today. Please let others know why you did, who you are protecting, and why it is so very important that all of us who are eligible take this step. I want to reflect on what we need to do now that we will be living without the Civil Emergency Measures Act in place. In addition to being vaccinated, the layers of protection that we know well also help protect ourselves and others. Some people are wondering, when should they wear a mask now? There are many details in the guidance on yukon.ca, but briefly, mask in areas where transmission is high or transmission potential is high. Mask in locations or situations where there are vulnerable people, people who are vulnerable to severe disease, and where you want to especially prevent transmission to others. Some people will mask out of precaution, out of respect. Some people will wait for those critical situations. Each of us will make that decision, and I ask that we offer respect and kindness to each other as we navigate these steps ahead. Please wash your own hands well and regularly. Take this simple step to use soap, wash with soap and water, and the whole 20 seconds to make it count. If you don't have soap and water, use hand sanitizer. This seems like such a simple, boring, and ordinary thing to do, yet it is so effective at preventing the spread of COVID-19. When you are out and about, please follow the guidance that you see in healthcare settings, workplaces, businesses, and in schools. Please check with communities and First Nations governments about any recommendations prior to visiting communities. I think we all know what to do, and I think we all know what to do, and we've all used these steps many times before. As we move together, there is guidance on yukon.ca for those who are not sure about how to use the tools we have. Before I end today, I want to remind you, please be respectful and kind as we transition, each at our own pace. We don't know what the situations and vulnerabilities of others may be, so it's important not to judge, but rather to build on our inclusive society, to be kind and patient, and to help each other as we walk this path together. Thank you. Shonitan, Gunalshish, Masicho, merci. I'd be happy to take any questions.
Thank you, Premier Silver and Dr. Elliott. We will now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start, and please also remember to mute and unmute yourselves. We will go to the reporters now on the phone lines, and we will start with Luke at CKRW.
Hi, this is probably a question best for the Premier. I know the demand for vaccine is probably significantly lower just because the majority of the eligible population has gotten it. Will the mass clinics stay open through the rest of the summer and maybe double as a flu shot clinic as well as we move towards flu season?
Yeah, that actually might be a better question for the Chief Medical Officer of Health as far as combining those efforts. I will remind folks of the amazing work that Health and Social Services did last year for the flu clinic. Record amounts of folks going for the regular flu shot. So we want to make sure that we maximize our potential to get as many people inoculated for COVID, but also having the opportunity for the flu as well. So I don't know if you have any updates on that, Dr. Elliott. But
the current plan is for the mass vaccination clinic to remain open. The specific hours are on yukon.ca. This is your shot. And yes, as we move into flu season, we are currently planning for the flu vaccination, and we'll have more information in the future.
Thank you. Luke, do you have a follow-up question?
I do, and this one is also for the Premier. A lot of jurisdictions around the country are enacting vaccination mandates for a lot of non-essential services. Is that something that you could see coming to the Yukon at all, or are we in a bit of a different position just given our population and our low case count?
You're right in identifying that every jurisdiction has their different needs and considerations, that's for sure. We're definitely, we don't have currently a mandate right now for mandatory vaccine policy for staffing or for, our healthcare or education staff. It is clear that vaccines, and again, I'll harp on this every time I have the opportunity to, is, provides the strongest barrier against COVID-19. As an employer, the health and safety of our employees is paramount. It's our top priority, and we strongly encourage all employees to get vaccinated. We're continuing to monitor these conversations and we're having conversations with public health directly. It's usually a good theme in the weekly updates between myself and the Chief Medical Officer of Health. And there's constant conversations happening internally, nationally, and we will continue to monitor those and determine whether additional steps are necessary. But at the moment, we currently don't have any mandatory policies for vaccines.
Thank you. We will now move to Nick with the Canadian Press.
Hi, thanks for taking my question. I'm curious if the Premier or the Acting Chief Medical Officer of Health could kind of explain the reasoning for lifting these restrictions when other jurisdictions around the country, I mean, speaking from BC, are seeing a surge of cases from the fourth wave of COVID-19. So I guess, is there any concern that these emergency measures will have to be put back in place due to a fourth wave, or? Yeah, just a bit more on the kind of reasoning for lifting this, please.
Great question. Our government is ending the state of emergency as a COVID-19 management tool, and we're doing that based upon the expert advice that we consistently get from the Chief Medical Office of Health. Now, since the pandemic was first declared, we've learned a lot about COVID-19 and how to manage it. Rising vaccine rates in Canada and low COVID-19 activity, have substantially reduced the risk of Yukoners to the Yukon for importation of cases, and we are all in very different situations now and also through the last 17 months as well. And we're comfortable in the alternative methods to manage the pandemic that are included in Forging Ahead, such as and also the Public Health and Safety Act as well. Though the public health risk remains, blanket public health measures are no longer the best method to protect the territory's population. We're following the lead of how to best protect our complete population. So we're moving to a more targeted approach that is now required. So as you read through Forging Ahead, the Yukon's continuing response to COVID-19, it's all outlined there, how we're targeting, what measures we're taking therein. The pillars lay the foundation for our government to continuously protect our most vulnerable population and enhance Yukon's well-being as we transition to a new normal. As for Delta specifically, you're right. We're watching the statistical relevance of other jurisdictions when it comes to the Delta variant. We also knew that it was only a matter of time, and we've been reporting that for a while now in these weekly updates. It will be only a matter of time until Delta variant arrives in Yukon. And seeing as both of the Delta cases in the Yukon contracted the variant from outside of the territory, and that at this time we don't have concerns about transmission due to those cases, it does not impact the greater population currently. So for the Yukon, what this tells us is Delta is likely a lot closer than most people think. and that it will be only a matter of time before we see more cases. And we're prepared for that through our Forging Ahead document. And, as we said in our opening statements as well, we will always pivot the way we have to. If we have to go back, then we have to go back. If we go forward, we're prepared to do that with a more targeted, focused approach, working in partnership with amazing leaders that we have in all of our communities. But I think that we're very well prepared and knowledgeable about the foreseeable future and using the data and the epidemiology in other jurisdictions as well to prepare ourselves for this more focused approach. Dr. Elliott, I don't know if you have...
Yeah. I think the question was about the importance, the different actions that are being taken across Canada to respond to local epidemiology in the provinces and territories. And why is our step to remove the Civil Emergency Measures Act while many other provinces and territories are responding to a wave with the Delta variant? One of the key aspects as we watch and move ahead in this time is each province and territory is responding to their own epidemiology, their own risk, and their own indications of risk at the time. We too will respond as things change in Yukon. We know that Delta is rapidly becoming the dominant variant of COVID-19 across Canada, and it has been associated with rapidly rising case counts in many provinces and some territories. We're currently closely watching the indicators of severity. Will we see more severe disease? Such indicators include the hospitalizations and deaths. In other places around the world with vaccination rates that are close to ours, when the case counts have risen due to Delta, the severe outcomes were many-fold lower than they were in prior waves, and that is due to the vaccination rates in the current wave. The case counts tend to rapidly rise, rapidly fall, and at times reach a higher level. In Yukon, we have experienced this since June. Our own case counts rapidly rose, they rapidly fell, and they have stabilized in August. We are actively watching, observing, and conducting our own situational awareness and are conducting our risk assessments based on what is happening in the rest of Canada, based on our own importation risk, and based on our own transmission in territory. Rather than announce each case of the Delta variant, we will do as we have done before with other variants, Gamma and Alpha, before. We will share the key milestones that really affect risk. We have announced the introduction of Delta into the territory, and the next milestone that we will announce will be when we see transmission of Delta in the territory. How soon we will see that will depend on a certain degree. It does depend on chance alone in terms of how many people cross the border, how many Yukoners return home infected. And it depends on our own use of public health measures after travel, for example, and also the basic things, stay home when sick, get tested, and of course, how many more people step up and get vaccinated so that we don't have the vulnerable pockets of people who are not yet vaccinated. In Yukon, we've responded effectively to one highly transmissible variant, the Gamma variant. And I am confident that we have the tools to respond to Delta when it becomes part of COVID transmission in Yukon. Thank you.
Thank you. Nick, do you have a follow-up question?
No, that's it for me. Thank you.
Thank you. We'll now move to Haley with Yukon News.
Thank you. My first question had to do with the situation in Ross River. I know, Dr. Elliott, you said the situation has stabilized. On August 20th, we saw the Ross River Denna Council put out a release saying that they had requested a rapid testing response on July 31st, but that wasn't granted until August 17th. I'm hoping you could talk about that decision to not do rapid testing response as soon as it was requested by the council.
I'd be happy to talk about the Ross River situation. We continue to see person-to-person transmission in households. We continue to see people who cross the border with COVID-19 and who then isolate once they're diagnosed. And we do continue to see situations such as Ross River, where we have seen a surge in cases, and we are seeing now a stabilization. We have worked closely with the community of Ross River and the First Nations government to ensure that the response is appropriate and it is commensurate with the risk. There is always testing in Ross River, that testing, and in all communities across the Yukon, and in close proximity for some very small communities, meaning within an hour's drive. That testing occurs in rural Yukon in community health centers, and that is sample collection. And when there's a situation, we can expedite the turnaround on those samples. That has always been available in Ross River throughout the past couple of months, as well as throughout the pandemic. We have remained and we continue to remain in close communication with Chief and Council and with government, and we have had regular meetings as recently as yesterday and continue to do so, as well as nearly daily contact with the community. We continue to assess the needs of the community and continue to provide the supports as needed. We will continue to keep a close eye on things as they continue to unfold in Ross River, and we will continue to respond as need be. It is also important to note that we take into account the needs, requests, and individual situations of individual communities, and that the response will always be tailored to both the epidemiology and the community situation. Thank you.
Thank you. Haley, do you have a follow-up question?
Thank you for that info. I do have a follow-up question. I was wondering, under the Public Health and Safety Act, can you compel individuals to get tested if there's suspicion that they have COVID-19? I know it was said that self-isolation can be compelled if they have a positive diagnosis, but I'm wondering, can you force people to get tested for COVID-19?
So I really don't want to get into all the technicalities of the Public Health and Safety Act because there are many, and we could be here all day. It's a legal document, and for anybody who's read legal documents, they have a sense of what that looks like. What I will say is that when there is a risk of a transmission to the public, then we can ensure that that risk of transmission is stopped, and we can use enforcement to do that. And we have many levers to do so. We use a graduated enforcement model, which means we always start with education and supports to compel people to do the right thing. And we do have the power of the law to prevent transmission when needed. Thank you.
Thank you. We will now move to Tim from the Whitehorse Star.
Yes, good morning. My questions are probably more to the Premier than anywhere else, but either one of you can answer. First one, you mentioned that you're in the process of coming up with some kind of vaccine certificate or something similar. What's the timeline for having that come out?
Good question. I would say, as far as we'll start with a letter from the federal government asking all the provinces and territories as we focus our lens towards certification, a plea or a request that we do it in a coordinated fashion. In those conversations, I would say BC and Yukon are, very much at the forefront of getting through that system. Health and Social Services has an excellent modernized digital system, and so does BC. We don't have any update today as far as those certifications, but we're moving forward with that. Now that there's a federal election, there's less conversation from Ottawa on these things, but we are preparing to head down to Winnipeg for the Council of the Federation's annual meeting. This will be the first time that we've met in person in a long, long time. But our meetings and conversations have been weekly at times, now a little bit more scaled back. But as soon as we have any more information to tell you about the verification systems and the certification systems, we'll make sure that that becomes available to Yukoners as soon as we have more to announce.
Thank you. Tim, do you have a follow-up question?
I do, and it is kind of related, again, for the Premier. You mentioned that Yukoners can use the small cards that they were given when they got their vaccinations. Are other jurisdictions actually accepting that?
Yes. And I think as we move forward towards a certification system, it's going to still be incumbent upon the provinces and territories to decide how they use a certification versus the cards. But again, it would be really helpful if as we move towards a certification as opposed to those cards, that these systems are uniformed as much as possible. But yeah.
Thank you. We'll now move to Chris from CBC.
Hi there. Yes, I guess this is for the Premier. Dr. Elliott said that the situation in Ross River is under control, but the latest update from the Ross River Dene Council kind of paints a picture of the precise opposite. There are a whole bunch of deep-seated issues there that are basically compounding the problems caused by COVID-19, staff shortages, internet shortages, a lack of housing, alcohol continuing to be purchased in Faro and sold to minors in Ross River, no arrests made by the RCMP. There's a long list of problems that the Ross River Dene Council has identified. Does the Yukon government have any specific plans to actually tackle this long list of issues as they relate to COVID-19?
Yeah, so I met with Chief Jack Caesar just yesterday, and we know that Ross River has been experiencing a high number of cases, specifically when it comes to COVID. We have deployed the rapid response team, so a measure that we're doing and working with the community on there, and also the community has the immunization teams that are present as well. Monitoring of that situation will continue, and will continue with every community, not just Ross River, to take the most up-to-date guidance from and recommendations from the Chief Medical Officer of Health when it comes to those situations. With regards to the school, Minister McLean, the Department of Education, Ross River Dene Council, the School Council, and the CMOH, as Dr. Elliott mentioned, discussed this situation and met this week, and continue to work with the community to ensure that those community needs are met. Whether it's Ross River, Faro, any of the rural communities, we have programs in place through Health and Social Services, through education, to address the specific needs. And the needs in one community versus another community are always going to be different. Our goal when it comes to COVID, as you know, Chris, will always be, to make sure that vaccines are present and encourage, not only through our own government and our leadership here, but leadership in the communities to, implore people to get vaccinated. And so we'll continue to do that, and we'll continue to monitor other situations, social issues in all communities, knowing full well that there's not one solution for rural communities. They're all going through different things. We all are. In the last year and a half of dealing with COVID, this has been a mental strain on a lot of folks. The effects of individuals, the health effect of individuals is something that every measure that we put in place has that in mind. The conversations with Indigenous communities, with rural communities, with municipalities. I think we've done an excellent job of making sure that the documentations, the processes that our government uses, whether it be for COVID specific or for mental or social issues in general, has the voice of those meetings and that leadership in mind.
Thank you. Chris, do you have a follow-up question?
I guess so. I mean, to be frank, Premier, that sounds like a really long way of saying no, there are no specific plans in place to help these issues in Ross River. One of the other bullet points in that release says that the COVID-19 announcements are often focused on Whitehorse and do not reflect Yukon's rural reality, and therefore do not inspire our members to believe in the messages being delivered by other levels of government. I guess, what do you want to say to folks in Ross River who basically don't believe anything that's coming out of the Yukon government in terms of its response to the problems that Ross River is having right now?
I disagree that nothing that we're doing is specific to all of our rural communities, including Ross River. I would say that the heart and soul of the conversations that we have with leadership is reflected in our procedures, whether it be COVID-related, health-related, education-related. There's always going to be a level of distrust of colonial governments in rural communities. I had a really good conversation with a mentor of mine about exactly that, who was hesitant to get his vaccination. And he's like, I follow science, I follow the updates, and it comes down to, after 120, 150 years of colonial rule, there's a distrust, and we get that. We completely understand that. But to say that our policies, our documentation, that our efforts in mental wellness and education doesn't reflect the individual needs of communities, I'll disagree with you, Chris, on that, and add that because of our awareness of the colonial situation, we implore the leaders in all of our communities to work with us to make sure that when people make decisions, they do so with the most up-to-date information. They help us. To help the community, to make sure that that what we're doing in partnership with each other does reflect their needs, and I believe that we do that.
Thank you. We'll now move to Lauriane at Radio Canada.
Hi, yes, I guess my question is for Dr. Elliott, and if I could get an answer in French, that would be amazing. Dr. Elliott, you mentioned that 80% of the eligible population is vaccinated in the Yukon, but you said it's not enough. So I was wondering if you had like a specific target in mind in terms of rates, as the territory is already well above the target set by the federal government.
Oui, merci Lauriane pour la question au sujet des pourcentages vaccinés qui va être suffisant pour notre guerre contre le COVID-19. Nous avons tous demandé cette question parfois, plusieurs fois depuis le début du pandémique. C'est vraiment, COVID-19 est vraiment un virus qui change, qui a toujours des nouvelles surprises et qui nous force à être très vigilantes et très créatifs et très stratégiques en notre réponse. Quel numéro est suffisant? C'est la même question que combien de personnes à l'hôpital à cause de COVID-19 et est-ce qu'on accepte? Ce qui est suffisant est quand tous les gens qui sont éligibles ont pris leur jab, ont pris leur vaccination, et quand on n'a pas encore des gens, des communautés, des familles qui sont vulnérables aux plus pires résultats d'une infection. Chaque personne qui devient à l'hôpital, chaque personne qui meurt à cause de COVID-19 est une personne dans Yukon et chacun, c'est très triste. Moi, je veux qu'on a un outil qui prévente, qui sauve, qui protège tout le monde à cette tragédie. Et on en a un outil qui est vraiment fort, et ça, c'est l'immunisation. Merci.
And Dr. Elliott, could I get you to repeat that answer briefly en anglais?
Je vais bien essayer. The question really is about the fact that we have 80% of eligible people in Yukon vaccinated, more than 80%, against COVID-19. And I've said that this is not enough. And the question is, what number is enough? I think we have to remember that COVID-19 is a virus that is completely something that we have not seen before in my lifetime, certainly, and perhaps in the lifetimes of many generations. This is a virus that's constantly changing, that's requiring our constant vigilance and requiring us to use all of the tools we have and to develop our tools as quickly and use all of the science evidence and community supports that we have, and also to adapt them. And we've seen this adaptation. A question like how many people vaccinated is enough is a question like how many people hospitalized is too many. Every person who ends up in hospital or who dies from COVID-19 is a person. Every time I say the word case, I know that's a person. There's a family, there is a community, and there is a territory that experiences this tragedy. And I think until, I wish I had a tool that could protect everybody in Yukon from this tragedy. And we do have a very strong tool, and that tool is vaccination. I think it's enough when everybody who's eligible, everybody who can, has done everything they can to prevent such a tragedy. And again, I encourage Yukoners, roll up your sleeves, take your best shot, and talk to those people who you know don't trust government, don't listen to these media briefings, about why you got your shot and what you are protecting and what is important, because this really is our best tool. Thank you.
Thank you. Lauriane, do you have another question?
Yes, actually I do. It's again for Dr. Elliott. I would like you to please explain, I know you've already mentioned it, but maybe explain to me in French what kind of power still remains in your hand now that the state of emergency is lifted?
Okay, thank you. OK, la question est au sujet de notre loi du santé publique et quel pouvoir on a avec cette loi. Je vais essayer de traduire en vrai temps ce que j'ai dit en anglais déjà. Maintenant, on n'a plus l'état d'urgence qu'on avait avant. À minuit ce soir, ça va être fini. Mais on a toujours des pouvoirs avec la loi de santé publique et du Yukon. Cette loi est très importante comme un outil, un pouvoir, et explique les pouvoirs qu'on a pour éviter la transmission du COVID-19. On a plusieurs pouvoirs avec cette loi et peut-être le plus important entre ces outils et ces pouvoirs est le pouvoir d'enforcement, les guidances aux personnes qui peuvent partager, transmettre le COVID-19 au sujet de l'isolation soi-même. cette isolation est un pouvoir qu'on peut enforcer dessus la loi de santé publique. Et au même temps qu'on préfère d'utiliser les outils d'éducation et aussi les supports pour ceux qui ont des difficultés d'isoler, on a la loi et l'enforcement quand il est nécessaire. On va toujours utiliser ces outils dessus la loi de santé publique et aussi un grand changement est que maintenant, les personnes peuvent faire leurs propres décisions au sujet de comment utiliser les mesures de santé publique qu'on avait et qu'on avait devenu familière avec pendant la pandémie. Merci.
Thank you. That concludes our COVID-19 update. Thank you again to Premier Silver and Dr. Elliott. Thank you also to all the media on the line and everyone who tuned in to watch live over Facebook. Have a wonderful Wednesday, everyone.